Hello and welcome to CPR Heroes. This channel is aimed at empowering you with techniques to assist a family member at home with a medical emergency. In this critical time, when our healthcare system around the world is under tremendous pressure and your country may also be in lockdown. My name is Daniel Joseph. I am Emergency First Respond Instructor number 194912. And today, we will be covering how to save a family member at home who is experiencing a heart attack through the following 5 objectives. 1. Definition of and symptoms of a heart attack. 2. Why every minute counts during a heart attack. 3. Definition of CPR and how it can help save the life of someone who has a heart attack. 4. How to determine if your family member needs CPR. And 5. What are the steps when treating an unconscious, non-breathing family member? In this 5th objective, I will demonstrate while you practice adult CPR for cardiac arrest. I upload videos like this at least once every week. If you haven't subscribed to this channel, please click on the subscribe button. Give this video a thumbs up, ring the bell, and share this video because together we can curb the number of lives lost due to heart attack. The World Health Organization estimates 17.9 million people die each year from cardiovascular disease. This amounts to 31% of all deaths worldwide. Based on a 2017 data from the American Heart Association, on average, someone dies of cardiovascular disease every 37 seconds in the United States. This means there are 2,353 deaths from cardiovascular disease each day in the United States alone. I recommend viewing this video at least once in its entirety, then getting the necessary materials and your family members together to practice what will be taught in this video. Do refresh what you've learned by viewing this video and practicing every several months. This video does not certify you as an emergency first responder. Therefore, I highly recommend signing up for a complete certification in emergency first response through the link in the description below. Let us begin with the first objective. Definition and symptoms of a heart attack. According to the National Health Service, a heart attack is a serious medical emergency in which the supply of blood to the heart is suddenly blocked, usually by a blood clot. We now know the definition of a heart attack. But how can we determine whether someone is suffering from a heart attack? Let's now look at the symptoms of a heart attack. The most common heart attack symptom is chest pain, which is angina, accompanied by pressure and squeezing in the center of the chest that lasts for several minutes or is intermittent and reoccurring. Heart attack pain may spread to the shoulders, arms, and neck. Persons suffering a heart attack may sweat or faint or complain of nausea, shortness of breath, and dizziness. They may deny that chest discomfort is serious enough for medical care. Use your judgment and don't delay alerting EMS, which is Emergency Medical Services. If you suspect a heart attack, the longer the heart goes without adequate blood flow, the more permanent damage is likely to occur. Note, not every country uses 911 as the emergency number. Therefore, it is necessary to find out the EMS number for your country. It is advisable to keep this number as part of your first aid kit and teach it to your family members. More on first aid kits in another video. If your family member complains of chest discomfort or pain, call EMS immediately and encourage them to take the recommended prescription medication for such discomfort or chew one adult non-coated aspirin unless they have an allergy or other contradiction to aspirin. Second objective. Why every minute counts during a heart attack. The heart pumps oxygen-rich blood throughout the body, It also returns the oxygen poor blood to the lungs for more oxygen. During a heart attack, blood flow to the heart is blocked. The oxygen-starved cells to the heart begins to die within several minutes. This leads to sudden cardiac arrest, which is the heart beats erratically or not at all. In cardiac arrest, brain damage begins within minutes. Severe and irreversible brain damage is likely by 9 minutes. This is why it is of utmost importance to begin CPR immediately. CPR extends the window of opportunity for resuscitation, greatly increasing your family members' chance of revival. Now that we are aware of what a heart attack is, the symptoms of a heart attack, and why every minute counts during a heart attack, let's define CPR and how it can help save the life of someone who has had a heart attack in this third objective. What does CPR stand for? CPR is the acronym for cardiopulmonary resuscitation. Cardio meaning heart, and pulmonary meaning concerning the lungs and breathing. Resuscitation means to revive from unconsciousness. So how do we perform CPR? CPR is a two-step process. First, press on a patient's chest, and secondly, blow in the patient's mouth, providing him or her with oxygen. Pressing on the patient's chest, called manual chest compression, substitutes for the heart's pumping action to circulate blood throughout the body. In essence, it forces oxygen-rich blood from the heart through the arteries and to the vital organs. The manual chest compressions deliver no more than 1/3 of normal blood flow to the body. Therefore, it is necessary to begin chest compressions immediately and minimize interruptions during CPR. Delaying chest compressions for any reason is counterproductive. CPR is used as an interim emergency care procedure until AED and/or EMS personnel arrive. However, it is a vital link in this chain of survival. Regarding CPR, if you are unable or feel uncomfortable giving a non-breathing family member rescue breaths, relax. Simply give them chest compressions. Chest compressions alone are very beneficial to someone who is unresponsive and not breathing normally. Your efforts may still help circulate blood that contains some oxygen. Remember, when assisting, that adequate care provided is better than perfect care withheld. If after providing chest compressions to an unresponsive family member, you are able and comfortable with giving rescue breaths, there is plenty of unused oxygen in your expired breath. To help the non-breathing family member, the air we breathe contains 21% oxygen. We use about 5% for ourselves. This leaves a very high percentage of oxygen in the air we breathe after each breath. The unused oxygen can be used for rescue breathing to support a non-breathing family member. Fourth objective: how to determine if your family member needs CPR. As soon as you determine a family member is unresponsive and not breathing normally, call EMS immediately and begin CPR at once. What does unresponsive mean? A family member who is unresponsive shows no sign of movement and does not respond to stimulation, such as a tap on the collarbone or calling their name loud. This is better known as a state of unconsciousness. What does not breathing normally mean? An unconscious or unresponsive family member taking gasping breaths is not breathing normally. In the first few minutes of cardiac arrest, a family member may barely breathe or taking infrequent, slow and gasping breaths. Do not confuse this with normal breathing. An unresponsive family member barely breathing or taking infrequent, slow, or noisy gasps needs CPR immediately. Now that you know what unresponsive and not breathing normally means, how do you determine when a family member is unresponsive and not breathing normally? First, tap them on the collarbone, then call their name and ask them loudly, "Are you okay? Are you okay?" After repeating this a few times and receiving no response from them, use the head tilt, chin lift method to open the airway. Then place your ear and cheek directly over the nose and open mouth while looking at the chest and still holding the airway open. Check for normal breathing by looking for the chest movement, which is the rise and fall of the chest, listening for breathing sounds, and feeling for expired air on your cheeks. This check should be done for no more than 10 seconds. We will go in depth with this shortly. Let's combine everything we just learned in this fifth and final objective. What are the steps when treating an unconscious, non-breathing family member? In this point, I will demonstrate while you practice adult CPR for cardiac arrest. You may wish to pause and repeat this part of the video as much as needed as you practice. Although you hope you'll never be in a situation with a family member experiencing a heart attack, it's important to know the steps to take so you can assist in the event it does occur. Experiencing nervousness during a time like this is natural, and your nervousness can make it difficult to remember what to do and how to do it. This is why it's paramount to practice the steps presented in this video with your family members at home until it feels natural, and complete the emergency first response course through the link in the description where you will receive certification. To help remember what to do, the mnemonic or memory word ABCABS can be used to remind you of the pathway and priorities of emergency care. By learning this mnemonic, you'll know what to do first, second, third, and so on when a family member has experienced a cardiac arrest. We are now going to go through a scenario where my wife had a heart attack while cooking on the stove. As she collapsed, she knocked a boiling pot over and suffered severe burns. We begin the scenario with me walking into the kitchen and finding her on the floor unconscious. Watch as I use the ABCABS priorities in this emergency. You may role play similar scenarios with your family members in and around your home. A. For assess the scene, alert EMS, apply barriers, and airway open. Assess the scene. Ensure it is safe for you to help without getting hurt. This is also a good time to stop, think of what to do, and then act. We will discuss scene assessment in depth in another video. What I am looking for are hazards, or if what may have affected my wife could affect me. During my assessment, I find the stove still lit and hot food spilled over her and on the floor. I will first get some dry towels in our storage, then turn off the stove, after which I will use the dry towels to cover the food on the floor so the floor isn't slippery and the food cools down enough for me to move to the next step. Once I feel confident, I will approach her and check if she is responsive. This is how it is done. Yan, are you okay? Are you okay? Yan, are you okay? Are you okay? Yan, are you okay? Are you okay? A. Alert EMS. As soon as I determine that she is unresponsive, I will call EMS immediately or have someone else call if possible.
Isa, call 911 immediately.
A. Apply barriers. Barriers like gloves, Eye shields and ventilation masks are used to prevent you and your family member from transmitting blood-borne pathogens and other infections to each other. We will go more in depth on barriers in another video. In this scenario, I am resuscitating my wife and I am comfortable performing CPR on her without any barriers. In most cases at home, you may feel comfortable resuscitating your family member without barriers. Final part of A, airway open. Use the head tilt chin lift method to open the airway. This is done by first placing your hand, which is closest to the forehead, on the forehead and gently tilting the head back while positioning the index and middle finger tips on your other hand under the point of the chin and lifting the chin to open the airway. B, check for breathing. Now check for breathing. By placing your ear and cheek directly over the nose and open mouth while looking at the chest and still holding the airway open, check for normal breathing by looking for chest movement, listening for breathing sounds and feeling for expired air on the cheeks. This check should be done for no more than 10 seconds, as mentioned previously. C, for chest compressions. Position your family member on the back, if not already in that position. Locate the chest compression site. This is done by putting the heel of your hand in the chest center. On some individuals, this position is between the nipples. You may expose the patient's chest only if necessary and find the compression site. Place your other hand on top of the hand already on the chest and interlock your fingers. Using the palm of your hands only on the compression site and fingers off the chest, deliver chest compressions by positioning yourself so that your shoulders are directly over your hands and your arms are straight, which is lock your elbows. Keep the force of the compressions straight down. Avoid pushing on the rib cage or the lower tips of the breastbone and allowing your body weight to deliver the compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of your family member's chest, between 5 to 6 centimeters or 2.2 to 2.4 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat this at a pace of 1, 2, 3, 4, and so on. Counting fast for 30 compressions. Perform the compressions as fluidly as possible. Your rate should be 100 to 120 compressions per minute. Ensure that you do not interrupt chest compressions for more than 10 seconds. A, for airway open. Use the head tilt chin lift method again to open their airway. B, for breathe for your family member. With the head still tilted back and your palm still on the forehead, shift your hand closer to the nose, pinching the nose shut with your thumb and index finger. In today's example, I will be giving mouth to mouth without any ventilation barriers since I am resuscitating my wife and I am comfortable giving her mouth to mouth. Again, in most cases at home, you may feel comfortable giving your family member mouth to mouth. However, remember, if you are not, chest compressions alone is very beneficial. Look for the upcoming video on barriers. Now give 2 rescue breaths, allowing about 1 second for each ventilation and providing just enough air to make the chest rise. Look for this rise in the chest. If you can't make the chest rise with the first breath, repeat the head tilt chin lift method and reopen the airway before attempting the second breath. Improperly opening the airway is the most common cause of not being able to inflate the lungs. Do not try more than twice to give rescue breaths that make the chest rise. Minimize delay between chest compressions. After 2 breaths, whether they make the chest rise or not, continue with the cab portion of the mnemonic, which is give 30 chest compressions again, followed by 2 rescue breaths. Following the same steps mentioned and continue alternating the cycle until one of the following. 1. EMS arrives. 2. You can defibrillate with an AED, which is an automated external defibrillator. More on AEDs in a subsequent video. 3. Your family member becomes responsive and begins to breathe normally. 4. Another trained person takes over CPR efforts. And 5. You are too exhausted to continue. Take special note of the following 6 points. 1. In this video, we only looked at adult CPR. Please stay tuned for subsequent videos on child CPR and baby CPR. 2. We do not take time to look for pulse. Studies show that even healthcare providers have difficulty detecting a pulse on unresponsive patients. Checking for a pulse takes too much time. Instead, immediately begin CPR if your family member is unresponsive and not breathing normally. 3. Never practice CPR on another person. I did the chest compressions on a stuffed carry-on bag, and you may use something similar. 4. Adult CPR involves chest compressions combined with rescue breathing at a ratio of 30 chest compressions first, followed by 2 breaths. 5. The S in the mnemonic AB-CABS stands for serious bleeding, shock management, and spinal injury, all of which CPR takes priority over. This is why the serious burns my wife suffered will not be treated until she regains normal breathing or consciousness. Again, because life-threatening conditions like not breathing always takes priority. Look out for follow-up videos on serious bleeding, shock management, and spinal injury. 6. The 6th point only applies to persons who are in Australia and New Zealand. Using the basic life support flowchart guideline 8, developed by the Australia and New Zealand Committee on Resuscitation, replace the mnemonic AB-CABS with the mnemonic DRS ABCD, and this is how they interchange. D. Dangers, replacing assess the scene. R. Responsive. Check for response by tapping your family member on the collarbone with your fingers, calling them by their name and asking if they are okay, a few times as demonstrated earlier. S. Send for help. This is equivalent to call EMS or emergency medical services. A. Airway. Open the airway. B. For breathing. Check for breathing. C. For CPR. This is equivalent to the cab portion of the mnemonic AB-CABS mentioned earlier. And D. For defibrillator. Attach an AED as soon as available and follow the prompts. More on this in a subsequent video as mentioned earlier. Now try giving CPR for about 2 minutes. You should complete at least 3 cycles per minute once done properly. First, practice slowly to ensure your hands, arms, and body position is appropriate and the steps shown are all followed accurately. Then practice the steps again in real time. You should find this very tiring and demanding. Therefore, it's recommended to have more than one person in the family trained wherever possible. One, two, three, 4, 5, 6, 7, 8, 9, 10. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Let's review the 5 objectives covered in this video. Number 1, we define the heart attack according to the National Health Service as a serious medical emergency in which the supply of blood to the heart is suddenly blocked, usually by a clot. Symptoms of a heart attack included chest pain, which is angina, accompanied by pressure or squeezing in the center of the chest that lasts for several minutes or is intermittent and recurring. This pain may also spread to the shoulder, neck, or arms, and one may sweat or faint or complain of nausea, shortness of breath, and dizziness. Number 2, why every minute counts during a heart attack? During a heart attack, blood flow to the heart is blocked, and the oxygen-starved cells of the heart begins to die within several minutes. This leads to sudden cardiac arrest, and in cardiac arrest, brain damage begins within minutes. Severe and irreversible brain damage is likely by 9 minutes. Point number 3, we define CPR, which is cardiopulmonary resuscitation. Cardio means heart, and pulmonary means concerning the lungs and breathing. Resuscitation means to revive from unconsciousness. CPR can help save the life of someone who has had a heart attack by a 2-step process. First, press on a patient's chest, and second, blow in the patient's mouth, circulating oxygen-rich blood to their vital organs. Point number 4, we answered the question, how to determine if your family member needs CPR. In this point, you learned what the terms unresponsive and not breathing normally meant, and CPR should begin immediately after concluding your family member is unresponsive and not breathing normally. And final point number 5, We covered the steps for treating an unconscious, non-breathing family member. I demonstrated this while you practice adult CPR for cardiac arrest. Do go through this fifth objective as many times as needed. Remember to subscribe to this channel if you haven't by clicking on the subscribe button. Give this video a thumbs up, ring the bell and share this video because together we can curb the number of lives lost due to heart attack. Follow the link in the description to sign up for the complete certification in emergency first response through paddy.com. Do leave a comment in the comment section, particularly about how this video has helped you in an emergency at home and other CPR or first aid topics you would like to experience. This has been Daniel Joseph, Emergency First Response Instructor number 194912 with you. Till we see in the next video, Yahweh bless and keep you. Shalom.